Going under anesthesia can feel like one of the most uncertain parts of surgery. You are trusting someone to take control of your body while you are asleep. And naturally that can raise questions or even fear. Will I wake up? Will I feel anything? Is it really safe? I'm Dr. Giga and I'm going to walk you through exactly what really happens and what we do if someone takes too long to wake up. Let's get into it. How do you normally wake up after anesthesia? When you are under general anesthesia, your brain is essentially put into a controlled, reversible coma. You don't feel pain, you don't move, you don't form memories. But once surgery is finished, we stop the anesthesia and your body starts waking up. Your liver and kidneys begin metabolizing the drugs, your brain gradually restarts to normal activity, and your breathing, heart rate, and consciousness returns to baseline. For most patients, this process takes just a few minutes. Within 5 to 20 minutes after surgery, you will typically open your eyes, start responding, and move into recovery. That's what happens in more than 99.9% of cases. So what if you don't wake up as expected? First, let's be clear. Not waking up after anesthesia does not mean brain death or permanent coma. In almost all cases, it just means delayed awakening. Why can this happen? Sometimes waking up after anesthesia can take a little longer, and that's okay. There are a few reasons this can happen, and most of them are simple and temporary. For example, if your body takes longer to clear the medications, especially if you have liver or kidney issues, you might need more time to fully wake up. If the surgery was long or if you needed stronger pain medications, that can also slow things down. And sometimes your body might just be cold. Anesthesia can lower your body temperature, and that alone can delay recovery. These are things we expect and we monitor them closely, so even if it takes longer than usual, it does not mean something is wrong, it just means your body needs a little more time. What do we do if that happens? If you don't wake up as quickly as expected, we stay with you and take care of everything. We check all your vital signs, your breathing, heart rate, blood pressure, oxygen levels, everything that tells us how your body is doing. We may give you medication to reverse the effects of certain drugs. It's not about pushing you to wake up faster, it's about supporting your body until it's ready. Is this dangerous? This is probably the most important question, and the honest answer is no. It's not usually dangerous. But in extremely rare cases, a person might have a severe complication during or after anesthesia, like a coma, brain injury, or even death. However, the numbers are so small that they are comparable to the risk of something going wrong during a commercial flight. Millions of people fly safely every day, and the same is true for anesthesia. The chance of not waking up due to anesthesia alone is extremely rare, especially when it's not an emergency situation and you are otherwise healthy. Severe complications usually occur in patients who are already critically ill or undergoing high-risk emergency surgeries. Even then, we work with extreme caution. And here's something very important. Anesthesia is not one-size-fits-all. It is carefully planned for each individual patient based on your age, weight, medical history, medications, allergies, and even your past experience with anesthesia. We take everything into account to make sure the plan is safe and tailored just for you. So when you lie down in the operating room, you are not just going to sleep, you are being cared for, watched every second, and protected by a team that knows exactly how to manage you every step of the process, including the wake up. So should you be afraid of not waking up? Honestly, no. Anesthesia today is safer than it has ever been in history. We monitor your brain, anesthesia depth, pain levels, muscle relaxation, as well as your heart, lungs, blood pressure and oxygen levels continuously during surgery. Yes, there are always risks in medicine, but not waking up from anesthesia is one of the rarest complications, and it's one we are trained to handle quickly and safely. Have you ever had general anesthesia? What was your wake up like? Were you confused, groggy, or did you wake up instantly? Share your experience in the comments, or if you have any questions, I'd love to hear from you. I hope this video helped bring you some clarity and peace of mind. If you found it helpful, feel free to like the video, subscribe to the channel and share it with someone who's preparing for surgery. Thanks for watching, stay safe, stay informed, and I'll see you in the next one.